Welcome to another episode of Startup Health Now, the weekly show celebrating the change makers and healthcare transformers that are reimagining healthcare. My name is Stephen Krein.
And I'm Unity Stokes.
And on today's episode, we're going to sit down with Asif Khan, the co-founder and CEO of Caremerge, a care coordination platform for senior care providers. This is going to be a great episode.
Stick around.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Welcome back to Startup Health Now. We're sitting down with Asif Khan, the CEO and co-founder of Caremerge. Welcome.
Hey, nice to be here.
It's great to be here.
It's great to have you.
Thank you.
So absolutely love what you're doing with Caremerge. For our listeners out there who maybe aren't familiar with Caremerge and your mission,
Really?
how do you describe it?
Yeah,
Two or three people.
Caremerge is, I can, tell you what it is, and then we can talk about how it came about also.
Yeah.
So Caremerge is a communication and care coordination platform, and what we're trying to figure out is how to eliminate the faxes and the phone calls and the emails and the texts and the papers and the whiteboards out of the healthcare system and automate it to a point where everybody can get the right information at the right time and make better decisions. Our immediate focus is where this technology is needed the most is senior care providers, right? Higher security patients living there for a very, very long time with most chronic illnesses, taking the most medications, have the most set of stakeholders involved in the care. So our focus is senior care providers because they're facing the challenge the more. As a nation, that's like the biggest healthcare expense for us too.
So how did you guys, what's the genesis of the idea? How did it come about?
Well, it came about, I'm a GE alum, so I spent 12, 13, 14 years at GE in various global businesses. And at the last one, I was at a GE healthcare IT business, and I was a global leader for Center City PACS, which is a big radiology infrastructure. As part of global leadership, you're involved in HIE discussions and, how do you connect healthcare and all those type of things. And, as this was going on, my parents, by the way, they volunteer in very remote areas. I found out that my mom was on ventilators one day, and I had to fly to see what's going on. So they volunteer, building, clean water supplies, orphanages, mobile dispensaries, schools, all kinds of stuff in the middle of nowhere.
That's amazing. You grew up with your parents doing that?
No. My parents are very highly accomplished people in Pakistan. So they retired, and they're like, oh, what do we want to do? We don't want to just sit there. We do something. So they go in the middle of nowhere and start building infrastructure that people need. Yeah, so they have a very purposeful life. But when to the point I got there, I'm like, Dad, commend you all for what you're doing, but you're really in a middle of nowhere. You have, in a developing country, and you don't have your information organized, right? This is kind of like suicide. You're growing old. You're in the middle of nowhere. You don't have. So he looks at me and he's like, well, Asif, you're a global leader at one of the biggest companies in healthcare in the world, GE. You live in the best country in the world, United States. Why don't you tell me which medications you took 3 months ago?
Blank.
Right.
Blank stare.
Right. So I'm like, oh, wait a second. So anyways, so that was really what kind of the idea where it came about. Like, what? I mean, we are.
So you actually saw this need from your own family, a personal situation that you guys saw.
Right. So when you think about that, then you think about, well, wait, why is that? I mean, we are so advanced in technology, right? We got thousands of mobile apps on health, right? We got hundreds of these devices, and there are going to be more and more, and there are hundreds of thousands of these clinical systems. but we're still stuck on paper and phones and faxes, and nobody has any information.
So how
together.
for the layman, how do you describe how this platform works? I mean, you guys have done so much in the last few years since you launched. How does it work?
Well, it really begins from the people who are actually doing the care work, right? So we are talking about not just the clinical people, but more actually non-clinical people, right? Who are the non-clinical people in high acuity settings for seniors, for elderly? They're your, CNAs.
Which are, for the listeners.
Oh, the certified nursing assistants. There are housekeeping people. They touch patients quite a bit. Activities directors. You have food service people that keep track of, this person has CHF, low sodium kind of diet, and all those types of complexities. So you have to start
capturing all of those things that are already happening in the workflow
that they're using paper and pencil and lots of phone calls and trying to figure things out in a non-structured way, right? Because if it's on paper, you can't structure it, you can't organize it. They're already doing it, and they have to be compliant by it, by the way, right? Because you have to document what this person did, what did you do at what time to what patient, not only clinical, but also non-clinical, right? So what we did is, I spent when I, with that example of my own experience, I came back, resigned from GE, spent a lot of time, a year and a half actually, in various senior care settings, just
knowing that you wanted to start something.
Right. I didn't know what it was. I know you got to solve the problem, but then you say, if you got to solve the problem, my parents are old. What are other people doing who are old? Nothing. There's nothing out there. So then you say, where do these people live? They live in either homes or senior living. What's going on there? Then you start to really figure it out, and you kind of realize that, everybody is aware of acute care, right? Hospitals, clinics, doctors, all sexy stuff. But when you grow old, you go into the senior living community, which is not really that sexy. And
although
what's
with the aging population,
right,
now,
it's one of the biggest things, right?
It's growing,
And then also with the healthcare reform, everything is moving away from acute care to post-acute, right? Value-based care, bundle payments, episode-based care.
So besides paper and pen, what are the alternatives for these providers?
Well, the traditional phones and a lot of calls that are disjointed, right? So a family member may call the director of nursing, talk about something, and a different family member may call the life enrichment director and get another answer. And then the same person is talking to the doctor, right? The family members talking to the doctors, whereas the facilities are talking to the doctors too. So it's just all hodgepodge and discoordinated kind of communication that's going on. But what we try to do is we say, okay, number one thing, you think about a senior care. It's very complex, right? There are 100 residents living, and for each one, there are at least 5 to 7 stakeholders, from therapists to home health to families to. So it's an exponential problem just in one community, right? So they have to be capturing a lot of this information for compliance purposes, right? So what we do is give them because we spend time in their shoes, so we know at the nitty-gritty level what information they want to capture, what kind of form they need to create out of that, and who's going to audit that and where that information goes. So we make it super simple for them to press buttons. Their automatically notes are taken, everything, and then we use that structured information because we know who needs this information. Does the family member need this information? Maybe the family member needs only 1/4 of the information. They don't want the whole deal. And then what does the doctor? Maybe doctor needs all the information. So we're really at figuring out.
What's the journey been like? You guys have accomplished so much already. Maybe share with the listeners where you guys are in the stage, and then that might be a good transition
right.
to some of the lessons learned.
Well, we started with a year and a half just spending a lot of time in our clients' shoes, just trying to understand how care is truly coordinated, not just like, here's a system, log in and you can. No, it doesn't work that way. You have to really think about different people, their roles, and what 3 buttons you're going to give each person. Because if you give them more than that, you just can't do it. So
you spend time with the customers.
Right, spend time with the customers, really understanding. And that's really, I think, where we kind of grew from there, because the more we talked to these people, the more we saw the need, the more we saw the pain points. And so we started to do that. We launched our first product and solution in late 2012. And then we kind of, continue plugging on just like any other startup. We got 2 clients, 3 clients, 5 clients. And then we raised our first super angel investor. That was 2013 summer. We raised about, some capital, about 2.1 million. And after that, it was a lot of bigger clients coming in. So we started to roll those out. And then we got a lot of requirements, like before raising this series, kind of first institutional round that we just closed last
Congratulations.
month. Thank you.
And I want to talk about that in a minute, but you finish up the traction piece because I think it's huge how you've evolved this.
Right. So I mean, before we kind of went and starting to raise capital, we really have already built a lot of the processes that allows us to scale, right? How do you connect sales with the rollout with the product with the marketing with the sales? So it's kind of like processes connected so we can scale. But then we signed up about 300 communities, right? That now we got to roll out. So it's a good problem to have, but also you need capital infusion so you can, add fuel to the fire.
So with 300 communities, how many users are actually, people do you have actually using the system?
We have about 300 communities signed up, but about over 120 are already installed and using it. So we got a little backlog that we got to catch up. But out of those, I would say the users, we have maybe about 20,000.
20,000 in less than 3 years, really. It's 2.5 years.
I would really think like maybe beginning of 2013, so about 2 years.
That's fantastic. And so you just closed this round of financing. You touched on it a second ago.
Right.
Talk a little bit about that real quick.
Yeah, so we raised about $4 million, and I'm just like super excited about who all have come into this round. Very visionary folks and very focused in thinking about delivering care in a different way, because you keep doing the same thing, get the same. You got to think about doing differently. So I'm super excited about the syndicate that we kind of pulled together. So who led the round? The Cambia Health led the round. One of the most progressive organizations I've seen on the payer side. I mean, definitely they're thinking about it totally differently.
Right, which most people don't realize is a blue. So,
right. So I mean, that's kind of like I think their origins are, or I don't know the intricate details, but. They're thinking about it differently, and that's where they could get what we were trying to do, right? I mean, we are trying to solve this problem in a different way. And then add to Cambia was GE Ventures, which, I guess everybody knows there's significant value there. Arsenal Health, who are very tight with Department of Defense and the VA, so you can see the linkage there. Generator, which is recently formed as part of Aging 2.0. They're super connected in the aging space where we also play in. And then also Ziegler and Linkage Fund. So Ziegler is kind of think of them as an investment bank for the nonprofit senior living communities. So gives us significant access to these providers.
So I want to touch on the makeup of this round because you have a lot of strategic investors. This is a new phenomenon. A couple of years ago, even entrepreneurs would not go to strategic investors this early. They would usually, first of all, strategic investors and corporates weren't interested this early in companies, and entrepreneurs were usually wary of getting involved. You weren't, and a lot aren't, and a lot of these organizations, GE, Cambia, and others, are now investing very early, leading the way for a lot of funding to come into the early stage space. How did you think about it, and how did you determine that versus going true venture as a first group of institutional?
Right. So there was obviously a lot of learning. This is when you raise capital, you learn. I think one of the things that a traditional venture, they just don't get healthcare. They can understand number of users and they can do the math. They can quantify it. But healthcare, a lot of the traditional VCs, they just don't have the understanding. Even if you look at a lot of the investments that have been made, they're more consumer-facing, right? Traditionally, nobody puts in money on the B2B side. So who invests in B2B is who's experiencing the problems in B2B, right? So Cambia, they want to keep their patients healthy, right? GE, they have a whole bunch of products on the acute care. They want to connect to the post-acute. I think it makes more sense for, at least in healthcare, for strategics to invest because they are experiencing the problems. so they know what they're looking for, so they can bet on it compared to traditional VCs, because I don't think they understand it.
Did anybody tell you to be careful of corporate or strategic getting involved this early?
Of course.
And what was because especially having come from GE and corporate, what was the dialogue around that? Because I think for entrepreneurs going through that today, it's getting a lot of people giving old advice, maybe even sometimes about philosophically how to approach it.
Truly changed over the last 2 years.
Right. A lot of people said that. I'll go back to the point, like, look, only those people can advise you well who know the problems, right? If you go to a traditional VC, sure, they say they can bring this and that to the table, but how much really they know the problem?
Yeah.
Right? I don't think they do. So
what was the process like of putting the syndicate together? I mean, you were in the Startup Health GE Entrepreneurship Program, which we announced 2 years ago. So you started, forming the relationship with GE Ventures then. You, of course, came out of GE Ventures. What was the process like for you as an entrepreneur?
Right. Well, complicated, but I think definitely that's where who you partner with and who you work together helps quite a bit. So for example, from Startup Health, we got quite a bit of help. So. And by the way, for the audiences, this is not prep. I'm just saying it because that's how it is. Because sometimes, you get talking about it. But really, so I think truly, for example, Katya made significant introductions to a lot of VCs because not everybody knew, Caremerge and a lot of those introductions. So that's where we started to kind of pull in the syndicate together. And then because of GE's early involvement, they knew how further along we are as part of the GE Startup Health, so it was easier for them, to say, we've seen you guys do pretty phenomenal things, so let's just. So I think that was the key part, and then the complications in bringing a syndicate together are just enormous. But you have to first get the lead locked in with certain terms, and then you have to review those terms with everybody else, and everybody has a tweak, and it's just back and forth.
What's your biggest lesson on that, getting that anchor locked in? Because it's obviously one thing to talk to investors and pitch them. It's another thing to kind of get a term sheet and get them sitting around the table. Biggest lesson learned from getting the anchor locked in?
I think my biggest lesson was. You really have to make sure all the investors you're talking to. I think the biggest lesson learned was making sure that we are organizing the syndicate, although we're not saying we're organizing it. So we didn't go out and say, we got these people. First, we just went out and we said, okay, this is what we're doing. You want to invest or whatnot. Then we got a lot of different term sheets. And from the term sheets, we were like, look, it's really valuable to have these guys in. And then you sell it to the others. So I think, I don't know if it's a lesson learned, but I just think you really need to build a syndicate without announcing a syndicate early on, by just collecting information and seeing who plays what.
So you're putting these pieces of a puzzle together in the background.
Correct.
While you're sort of building it.
Exactly.
And did you find the interest changed once you got Cambia in, and were you able to bring the others in, either quickly or more efficiently as a result, or how'd you dance around that piece? Right.
So once we got Cambia locked in, then and that's the part of the lesson learned is like sometimes if you don't communicate enough, then they think that nothing is happening. So you got to communicate, but don't communicate too much, or communicate in a way that things are progressing and here's the next step. I think the key thing is giving everybody timelines and setting expectations, so there's no confusion. And I think you have a better chance of doing it, obviously, if you got a lot of people involved. So that was a blessing, I guess, in our case. But the way we organized it, once we get Cambia locked, then we had specific one-to-one meetings with Cambia, because if somebody's going to be on the board, they need to make sure they're comfortable with other investors, what value they're bringing, because it's a very small round. If you look, $4 million, like Cambia could do multiples of that by itself.
Yeah.
But to
each of them could. Each of them
easily,
and
each of them wanted to. So we were just too much oversubscribed. But the point is, we made sure that we had enough thought process and homework done with each of them. So when we went with Cambia or we went with others, you have to convince GE to say, GE, you're going to put in less than your traditional input because Ziegler brings this, Arsenal brings this, Generator brings this.
Yeah, this was not just about the money.
Exactly.
Before we move into a little bit about your vision of the future, I want to talk a little bit about your partners, understanding how you divide and conquer a little bit. But most importantly, you guys shifted from corporate, especially you, corporate to entrepreneur. And I want to kind of give a sense of, we talk a lot about they're just different beasts altogether.
Right.
Not everybody's cut out for entrepreneurship or
Correct.
startup world. What's been your biggest the biggest lessons learned and biggest insights from doing that, and then also wrap in, Michael and Fahad.
Right. So, spend a significant time at GEs. I think, number one, I think corporate is one thing, and I think there are two types of people in each corporation. There are people who are entrepreneurs, and then the corporation has to adjust or has to be able to accept those people and give them leeway to do things. And then there are other type of people who are in corporate leadership, executive, 9 to 5 kind of thing, and cushy job and fantastic. So I think there are those two types of people. I think I was more of an entrepreneur, and I was with a fantastic company like GE. I mean, depending on which team you are, I've been very lucky to be in teams where if I have a business case for my next 2 years and I say I want to do this, and it doesn't have to be just within my product or what I'm doing. GE is all about, or at least the groups I was with, I had some idea, crazy idea, I want to do this, and it was out of my realm of things, and the business saw that it's a need and they needed a leader to do it. Oh yeah, Asif, go do it. And then it allows you to, just maneuver through a very big organization and convince a lot of people who don't report to you to get things done. So I think those are some of the things that I think that I learned at GE, being an entrepreneur, in moving around different organizational and getting stakeholders buy-in. So when I thought about starting Caremerge, I think a lot of that was very helpful, at least for me. Right.
Was it a scary decision for you to sort of leave the corporate world and take that step off the cliff?
Of course. It was huge. I mean, it was impact. I mean, we know that impactful to our families. Mm-hmm. I have 2 kids. I was lucky that my wife is a physician, so that helped.
She understood the problem.
Right. She understood the problem, but she's very risk averse. So it took a lot of convincing, and then, your parents and her parents and everybody's like, Asif is quitting job.
So what wisdom would you share? Maybe there's other people in the corporate world that are thinking of taking that leap and maybe considering being an entrepreneur. What would you tell them? What wisdom would you share with them?
It's
You say run, don't do it.
Right. Well, I think there is quite a bit of homework you gotta do. You just can't just wake up one day and say, I think I'm gonna just quit my job and do something. I mean, I don't think that's smart. I think you really have to do a lot of homework and understand what you're getting into, what problem you're solving, and make sure you talk to a lot of customers. Everybody, you got to talk to the customers to say if they are willing to buy a product from you that solves something for them. I think that's something you can do on the side. I mean, you don't have to, as long as your, non-competes with your organizations doesn't, conflict. But, that's something you can easily, talk about. So I think that was the first step for me, is to really talk to a lot of people in the industry, try to understand what's going on. And then, it is something in your gut, I think, that and I would hate to do it. You can do a lot of this analysis and everything, but I think at the end of the day...
Did you feel like you just had this burning desire to be an entrepreneur?
I wasn't really thinking about being an entrepreneur. I was thinking about solving a problem.
Yeah.
I think that's what I was thinking about.
And how'd you bring Michael and Fahad into it? I want to bring in, because we've worked with you for the last couple of years as part of Startup Health and gotten to know your partners, and you got an extraordinary team. So.
Yeah, and it continues to grow, actually, which is really phenomenal. So Michael came from Time Warner. Fahad came from a very large organization that provided learning management systems, cloud-based, to huge global companies like Toyota or L'Oreal or Black & Decker. So I met with Fahad, and I told him, hey, this is what I'm doing. So initially,
you knew him from?
I knew him through a personal connection. So my wife's cousin was Fahad's best friend. So
There you go.
he's like, oh,
That's
you
the way
need
it
a
always happens,
technology
actually.
co-founder.
Yeah.
Here is somebody you can talk to. He's always looking to do something. So we were just starting to talk about, and I think when I quit my job, that's when Fahad was like, whoa, okay.
He's serious.
You're serious, so it's not going to be part-time, it's full-time deal. And then Fahad quit afterwards.
Yeah. By the way, that's a big point in the life of a startup when people start quitting their jobs to do
Correct.
it. Everybody realizes that the person is
Right.
serious, and then all of a sudden, not only does money
Absolutely.
show up, people show up to help.
Absolutely, because you can talk to everybody and all the investors, everybody, and you can, I think, throw out a lot of these ideas, but nobody takes you seriously unless you are serious enough to do it. And I think to your point about, what, insights, I think is that a lot of entrepreneurs or people, they're so scared of sharing their ideas that they miss out on the opportunity to learn. That was one thing that I was very open. I was like, what do you think about this? I'm going to do this. And people would get real-time feedback, and you learn.
Yeah.
You learn so much from that conversation. And if you're like, oh, we're, under the radar, and I was like, you're just missing out on opportunity to learn because you have these false hypotheses that you cannot clear the hurdle to go forward. So that was me.
And how did Michael get involved?
Michael was at Time Warner. Michael initially invested. It was just an angel investment. He's like, oh, I'll just do it and help. Let me know if I can help.
Again,
And
after you quit, he gave them.
I quit. Fahad had quit. We had some friends and family investors in. We had some, money, so we were doing the product development. So Michael, that's when Michael came in, and he's like, oh, I think I'll put in some money. And then, he's like, let me know if I can help. So 2 hours a week to 4 hours a week to nights to taking time off from work to meet clients. So he's like, so that's when Michael
Love
quit.
that. That's so authentic.
Awesome.
Just a natural way of
Right.
it feeling right and being right.
Right.
And we so often talk to the entrepreneurs about the difference between quitting and actually starting it versus talking
Right.
about it. And it seems like had you just continued talking about it, none of these pieces would come together.
It would not have, because you got to talk to people. And that's actually some of the other things. We brought 3 new team members, new, but we know them for a very long time, which goes back to, although you're 2 or 3 people founding the team, you really got to think about in the future what type of people you need. So you look for other entrepreneurs. So Carol Zindler, she came from a startup that was very successful, sold it to McKesson. So we brought her in from client experience. Terry Sullivan, she started a company called Connected Living, was one of the founding team, brought her in. And recently, Kim Kessler, she was one of the, she's the president. She was the president of a company called Touchdown in senior living.
That's great.
Phenomenal progress. And now we brought her in to lead product. So
Can you talk more about that? You talk about the future and where this is all going. Where are things going with this aging population and senior care, and what's your outlook?
Right. So senior care has been neglected for a very, very long time, right? That's why you always hear about people or entrepreneurs or technology focusing on the acute care side, but nothing post-acute, right? Because not sexy or for whatever. But with the aging demographics, right, that we all know, and everybody knows the numbers, it's just phenomenal. And it's a global problem. It's just not a U.S. phenomenon. It's actually much worse in outside of U.S. So it's becoming a problem. And as countries and as humans, we start to figure out, what does this mean? Is it just clinical? No, it's more than that. Life doesn't end when you grow old. It should continue to evolve and continue to be an excitement, for you. So I think one of the key things that we're doing is our product is commercial grade, it's robust, we're scaling. So there are 2 things that we're focusing on. One is to continue to provide our services and solutions to senior care market. This is simple, we already got it. The other thing is where we are starting to kind of feel, because Caremerge, is not only, helps you coordinate care clinically, but also non-clinical, right? Which is actually more important. Because think about it, right? Clinical is after the fact. how do you get to clinical is your lifestyle.
Your daily habits, your life,
right,
everything.
what's going on there.
Yeah.
So senior living, people live there for a very long time, and you can avoid clinical events from happening, and they're required by law and regulations to capture a lot of stuff. So this is our focus, but think about it. If you have a platform which are allowing families or physicians or specialists or home healthcare, all these different people to come together and coordinate, you have to build it based on very specific rules, see what they need to see, strong authorizations so nobody gets unnecessary access, and then permissions. Within the authorizations, what permissions I have. So as a power of attorney, I have different access than just a family member, right? So when you build that, and you now our focus was always about how do you avoid bad things from happening to very acute patients. And this is where the healthcare is going too, right? Bundle payments, episode-based care. Risk conveners are going to be responsible for patients outside of their building for 90 days. How are they going to do it? Put a whole bunch of people with phones and faxes? That's not going to work. So this is where Caremerge, I think one of the things that we're focusing on for a big initiative for this year is to show the country or the world a model with Caremerge that this could happen, where people are not necessarily in a care setting, they're outside, but everybody's plugged in, and the right exceptions are being notified to the right people, so they're making the right choices in the most simplistic form. So those are the two big things: scale what we got, and then leverage the existing platform into bundle payments, episode-based care, more automated and exception-based.
And as you look out 5 or 10 years, what are you most excited about?
I think
are we going to start to solve some of these problems? This is, you mentioned this really is a global phenomenon, global issue.
Absolutely. I'm very excited. I'm excited about the partners we have, like Startup Health, starting with Aging 2.0, Generator, Ziegler's of the world, GE, Cambia. So we got all different types of people involved who understand what we're doing. So this gives us global access, and our vision is to be a global care coordination platform, and it'll be funny to watch this video 5 years from now and see what's really going on. But why not? Health people are growing in masses, and we don't have enough people providing care. So it has to be, there's a demand and supply problem that we have to resolve. And you only can do it if it's a global solution.
And the genesis of the idea with your father in Pakistan and you in Chicago started as a global issue.
Exactly.
As a kind of final question, I'm interested a little bit more about you and what you read or are reading. So I'm going to ask you either about a favorite book, a podcast, or something that you're kind of consuming right now, or just finished consuming that you has really affected your worldview.
Yeah, I'm reading actually 2, 3. That's why I can't pick one.
Sure, pick. Give me
I'm
2.
just trying to think of. I'm reading. There is one book that Big Things About Big Things. Or big.
The hard things.
Things about. Sorry.
Yeah.
That's the problem.
The hard things about hard things.
Horowitz book.
Ben Horowitz's book.
Right. That's a good book. Because it really it's very simple, easy, because you can just pick a chapter and say, oh, I want to understand scaling. Some of the things I don't really agree with, I don't know, but you cannot agree with everything anyways. But some of the things are pretty nice and helps you organize your thoughts, I think, with respect to a startup. Another one that I read recently was Predictable Revenue. That was really nice because it helps to... Once you have a market product match, then I think it's a good book to read, so you can start to figure out how you're going to go about it. So yeah, those were a couple of books that I've been reading.
Fantastic.
Excellent.
Well, this has been great. Asif, getting to know you and your team and watching you over the last couple of years is nothing short of amazing, and love how you are being so thoughtful about the different things that you're doing, from the partnerships to your customer base to how you're really, rolling up your sleeves and getting in there. So you embody all characteristics of a healthcare transformer, and a 10-year vision and actually execution over the last few is pretty amazing to watch. So thanks for being on the show, and appreciate having a front stage seat to help and do everything we can to help you be successful. And what you guys are doing, I think, is going to inspire a lot of other people to kind of take a crack at this part of the market, because there's so many different opportunities that need to be solved.
No, thank you. And I think we're just humbled. We set out to, I think, really solve a problem. And I think as long as you focus on solving the problem in the most efficient manner and start to solve it, I think everything starts to come together.
Fantastic.
All right.
Thanks again for
you.
listening.
Thank you.
All right. Thanks for listening to another episode of Startup Health Now. You can find this and all episodes of Startup Health Now at startuphealth.com/now. Thanks for listening.
Have a good day.